All right, I would first want to verify the provider's orders that trach suctioning is what was ordered, and it was. And then I'm also checking for any allergies that would prohibit me from using any of my materials for the trach suctioning. So I have checked all of that, everything's good to go, and then I want to gather all my supplies. So I would put on PPE as needed, and it is not needed today. And then I would verify, I've already verified a smaller trach and an obturator at the head of the bed if I were to need that. I've already checked my patient's inner diameter and it was 6, so I would multiply that by 2 to get 12 for my catheter. And so that's what I have in my kit. I have a 12 French suction catheter. And then I also have my normal saline. So I've gathered all my supplies and now I can enter my patient's room. So I would walk in, provide for privacy, I would get hygiene, and then I would introduce myself to the patient. Hi, my name is Kylie. I'm a nursing student. Your provider has ordered some trach suction for you today, so that's what I'm here to do. I'm gonna go ahead and have you tell me your first and last name. Okay, and your birth date. And do you have any allergies? Okay. So patient has identified themselves using 2 identifiers, and I have checked the bracelet. I could also hold the MAR up to the bracelet to check it that way as well. So now I will explain the procedure to my patient. So my patient is alert, but I would also explain the procedure even if they were not. All right, so have you had any trach suctioning before? Okay, so you kind of know what to expect. I'm going to be using a small catheter, kind of just looks like a little tube. I'll insert that into your trach, and on my way out, I will suction and try to get all those secretions. I'm gonna be as quick as possible, but if you have any distress, I just want you to raise your hand, let me know, and we'll stop the procedure immediately, all right? So I've explained the procedure to my patient and also established a distress signal. Then I want to do any assessments before I begin. So during these assessments, I'm specifically looking for any secretions and lung sounds. So I would take my stethoscope and I want to listen to lung sounds bilaterally. So I have assessed, and I assessed minimal clear secretions as well as coarse lung sounds noted in the upper lobes bilaterally. So this does indicate that suction is indeed needed. And then my other assessments included a respiratory rate of 18 breaths per minute, a heart rate of 76 beats per minute, regular rate and rhythm, no retractions, no shortness of breath, and no restlessness. So now I'm good to go ahead and get my patient ready for the procedure. So we want the patient in the appropriate position. So we want a semi-Fowler position. I already have the bed raised to my working height. And Mr. Gay, I'm just gonna sit you up just a little bit more, okay? Okay, so we want them sitting up in a semi-Fowler position. So I now have them in that position, and my next step would be to set up my suction, if that wasn't already set up for me on the wall. So wham bam, that's all set up. And now I want to go ahead and turn on the suction, so I'm not turning that on when I am getting ready to start the procedure. So I would turn that on to 80 to 120 millimeters of mercury pressure. So I've turned that on, and then I'm just going to grab the suction. Mr. Gay, I'm gonna lay this right here on the side of your bed. And I'm laying this on the side of the bed so that when I have my sterile gloves on, it's already right here for me to reach and attach easily. Then before I get my table set up, I want to go ahead and hyperoxygenate my patient so that they can be getting oxygen before I start the trach suctioning. All right, Mr. Gay, I'm gonna place a trach collar on you. This is just gonna give you some oxygen while I prepare my materials. I'll take that off right before I do the suctioning and place it right back on afterwards, okay? So I want to set this comfortably on the trach, make sure that O2 flow is going into the trach, and then I would secure that. Then I would turn the O2 flow meter on to 100%. So I've done that, and now my patient is hyperoxygenating. So then I can go ahead and set up my table. So I would first wipe down my table. So I now have a clean surface. I want to open my kit flap away from me. I'm going to remove the sterile gloves from the kit and set those aside. I'm going to pick up my sterile box and open it up, ensuring not to touch the inside of the box. And I'm going to set that aside. And then I'm going to get my sterile saline solution, and I am covering up the label. I'm going to remove the cap and place that upwards on the table. I would pour some of this out to cleanse the lip of the sterile solution, and then I'm going to pour 30 to 50 milliliters into my sterile box. Okay, and then I will just recap and set aside. Then I can go ahead and put on my sterile gloves. Okay, so I have my sterile gloves on. I will just get rid of that wrapper. And my right hand will remain sterile through the whole procedure. My left hand will break sterile when I attach my suction to my catheter. But for right now, both my hands are sterile, so I can grab my suction catheter and remove that from the packaging. I'm going to coil this in my right hand. And I'm leaving 1 to 2 inches, holding that away from the tip. Then I will break sterility with my left hand, and I am going to attach the suction to the catheter. Okay, so I've attached the suction to the catheter. I have my thumb over the hole, which starts suction, and then when I let go, it stops suction. I'm going to test that and lubricate the tip of the catheter. So the suction is working. Now I'm going to get ready to suction out the trach. All right, Mr. Gay, I am going to remove your trach collar. I will insert the catheter, and on my way out, I will suction. I'm going to insert until I feel any resistance. Then as I am withdrawing the catheter, I will turn the catheter and suction on my way out. I would either hold my breath or count to 10 during this to ensure that I'm aware of how long I'm inserting and withdrawing the catheter. But since I'm making suction sounds, I will just do that in my head. Okay, I am going to use my left hand to remove trach collar and set that right here. Okay. Okay, and I feel resistance. Okay, so I have suctioned out the catheter. The trach, I'm going to immediately hyperoxygenate my patient again. And then I would have a nurse come in and assess my patient, because if any more suction is needed, this hand has to remain sterile. So I've had a nurse come in and assess my patient. Respiratory sounds are good, regular heart rate and rhythm, and lung sounds were clear, and no secretions were assessed, so no further suctioning is needed. I would go ahead and flush out my suction. Okay, I've done that, and then I can coil the catheter up in my hand. Take off my glove. And throw those away. And then I would turn off the suction. How are you doing, Mr. Gay? Good, okay. Are you comfortable? Okay, so my patient is comfortable, and I would lower the bed all the way. Side rails are up, and patient has the call light in their hand.